Urinary sheaths, or condom drainage as I probably normally call them, are a product particularly for men. So I'm sure most people are aware of what a condom is. So these are adhesive condoms that you actually attach over the penis or roll on over the penis, and they stay in place for about 24 hours. They have an outlet at the end, and you can connect a drainage bag to that. So they're not suited to everyone, but for some men particularly, because they don't necessarily like wearing a pad or they don't want the pad sitting right at the back, condom drainage can be a good alternative. And there's quite a big array of condom drainages around. You need to be sized for a condom because penises vary in size and also vary in length. So there is different size circumferences or widths of condoms and also different size lengths of condoms. There is a bit of an art to using condom drainage, so it is often important to have either a continence specialist or experienced nurse to be involved in trying or sampling condoms, finding the right one for you. Some are more adhesive than others, so it's really good that you maybe, if you want to look at condom drainage, you get some samples again, because the companies will supply often a week's worth of condoms or at least a few days worth of condoms to try, plus drainage bags, so you can have a leg bag during the day and then a larger night bag overnight. And as I said, after 24 hours, you'd remove it, clean the penis, and then put a new condom on. As I said, it does take a little bit of work and education to get the right condom for you, but they can be actually really quite good. They can manage quite a large volume of urine as well. And some men really, really like using a condom as an option.
Okay, and with the leg bag, during the day, what sort of volumes are we talking about?
So leg bags often range for, say, 500 mils to 800 mils, but you'd need to empty it about, every, say, 3 or so hours, or when it's about, say, 2/3 full. You don't want it to be completely full because it starts to drag too much, so you need to be able to manage to empty that. But say, for example, a man who's in a wheelchair, that might mean that he can go out for the day with, he's got a condom on because it can drain out, and say if he can open the taps, because a lot of the bags do have taps that say if you've got limited hand function, you can still open the tap and drain it. Or you might find if you've got quite a large capacity bag, say, 800 mils, you can get out all day and not need to empty it at all in that time if it's well supported. Yeah, so they can be quite useful and a good option to consider if that's something you'd be interested in. But again, need someone to support you with it. Make sure you have the right size condom, not too small, not too big, a measured penis. We often do a bit of trimming of pubic hair, thorough cleaning, thorough drying, all that sort of stuff when we use condoms.
Okay. And in terms of the penile sheaths, he's asking, can you use them if you have a retracted penis, or do they roll up a bit?
There are shorter sheaths, so you need to have at least a little bit of penis length. So as long as you've got a little bit, a couple of centimetres, we can use a shorter sheath, or they've also got a different name like a special or something like that. So there is an option for that. There has been around some urinary collection devices that are a bit like a stoma bag that you sort of put on over the whole area, but that's often better for someone who's not moving, who might be in bed all the time. But yeah, if you've got some retraction, it's still possible, but you want to have at least some length of penis. You don't want it that it's totally flush with the abdomen. You want to have a little bit of a couple of centimetres length.